I'm Myri Wallace. I'm a gynaecologist. I have a particular interest in urinary incontinence and pelvic floor surgery. You'll have had your surgery and is now the recovery phase. It is crucial that you look after yourself correctly and do the correct exercises. Physiotherapy is more than simply contracting and relaxing your pelvic floor muscles. This video has been compiled by physiotherapists who are specialists in pelvic floor rehabilitation. I cannot stress to you enough the importance of taking their advice.
Following your surgery, your body is in the process of healing. For some of you, this can be a frustrating time as you will need to curb your activity. Many simple tasks such as housework and childcare will place too much strain on your healing tissue. Now is the time that you need to balance rest with activity. This advice is provided to give you the best outcome for your surgery. Important muscles and how to exercise them. Strong trunk and pelvic floor muscles help to protect the back. Depending on the type of surgery you have had, your muscles will have been disturbed and therefore weakened. Whether you have had your pelvic floor repaired or abdominal surgery, you need to gently exercise these muscles to regain their strength and function. You may begin exercising these muscles soon after surgery. Pelvic floor. The pelvic floor muscle sits at the base of the pelvis, supporting the bowel, bladder and vagina. A strong pelvic floor muscle is important to prevent bladder leakage and control wind. Pelvic floor exercises can be a little tricky at first. As you can't see the muscles, it is not always easy to be sure you are doing them correctly. At first, lie on your side, or if comfortable, sit in a well-supported position with legs shoulder-width apart. Later you will be able to do this exercise in any position. Make sure your bottom, thighs and tummy are relaxed. Think of the area around the openings of the bowel and bladder. Gently close the openings and lift up inside as if you are trying to stop passing urine and wind. Hold this for 2 relaxed breaths in and out. Repeat 5 to 10 times. Transversus abdominis. When you contract your pelvic floor muscles, you may feel your lower tummy gently tense. This is your transversus abdominis muscle. It wraps around the lower tummy like a corset and attaches to the spine, co-contracting or working together with the pelvic floor to stabilize and prevent strain on your back. Again, at first, either lying on your side with a straight back or sitting comfortably, breathe in, filling your tummy with air. As you breathe out, close the openings and lift as you did in a pelvic floor muscle contraction. Then gently draw in the section of your tummy below your belly button. Keep holding these 2 muscles while you breathe gently for 2 relaxed breaths, then slowly let go. Remember to contract the pelvic floor and gently tension your lower tummy before changing position, lifting or coughing. Make these 2 exercises a lifelong habit, weaving them into your daily activities. Cough. Always prepare for coughing by tightening your pelvic floor muscles and lower abdomen. You can also sit down to support the pelvic floor during a cough or sneeze. If still sore, use your hands to support your wound. Some people also find it more comfortable to hug one knee up towards their chest when coughing, if you are able. Walking. For the first 6 weeks, avoid standing for long periods and too much walking. Gradually increasing walking is the perfect way to build fitness and prevent blood clots. To start with, around the house and garden will be enough. Then slowly increase your distance so that you are aiming to do a little more each day. If you feel any dragging, heaviness or aching, you will know that you have overdone it and you need to reduce your distance when you do your next walk. You are better to do a little and often rather than one big walk at once. If you become tired, take a short rest. Climbing stairs will not cause any problems with your stitches. Rest. When resting, either lie down or sit with your feet elevated. It is normal to feel tired when you return home and need a rest during the day. Lifting. For the first 4 weeks, avoid lifting anything heavier than the weight of a full kettle. You need to ask for help with any heavy lifting, such as moving furniture, lifting children, or a wet washing basket for at least 3 months following your surgery. It is very important to look after your back after abdominal or pelvic surgery, especially when lifting, even when it is only something very light. When lifting, keep your back straight. Get as close as possible to the item you are lifting. With one foot slightly in front of the other, bend both knees into a squat or go down onto one knee. Brace your pelvic floor and deep abdominal muscles. Stand up using your strong leg muscles, keeping your back straight. If possible, place items on a chair so that you are not having to lift from the floor. Housework. Take things quietly for the first 2 weeks you are at home. You can make a hot drink and help with light household jobs. After 4 to 6 weeks, you can gradually increase the household jobs. Pace yourself. Do 10 minutes of an activity and see how you feel immediately and also the next day. Overhead activities such as washing windows and hanging out washing and changing bed sheets put strain on internal stitches. These activities need to be avoided. Ask someone to help. Avoid vacuuming, shopping, and cleaning the bath and shower for 4 to 6 weeks. Avoid repetitive bending. Buy an easy reach from mobility or $2 shops if required. Back to work. Your doctor will advise you when to return to work. This depends on your type of surgery and the physical nature of your job. Driving. We recommend you wait 4 to 6 weeks before driving. You need to be able to wear a seatbelt, move your legs quickly, and turn in the car seat. Also, check your insurance policy to make sure you are covered. Sport and hobbies. Recovery from surgery varies for everybody. It is important not to push beyond your ability to cope comfortably. High-impact activities such as running, tennis and netball should be avoided for 12 weeks. This should be discussed with your surgeon. Some exercises that increase downward pressure on your pelvic floor, such as sit-ups, can cause vaginal repair surgery to fail. Do not swim in chlorinated pools or spa baths before your 6-week checkup because of the risk of infection. Toileting. Aim to avoid straining when emptying the bladder and bowel. Good fluid and fibre intake and positioning help. For the best positioning for toileting, sit on the toilet with the normal hollow in your lower back. Bend forwards at the hips and let elbows or hands rest on knees. Raise heels off the floor so that knees are higher than the hips. You may need something such as a phone book to lift your feet off the ground. Allow your tummy to bulge as you empty. Look straight ahead. Relax and remember to breathe. Tighten up your pelvic floor before you leave the toilet. Travelling. If you have to travel a distance to return home, remember to continue to do your circulation exercises for your legs. If in a car journey, try and stop hourly and mobilise. Also, avoid heavy lifting such as heavy bags, as this will affect the wound healing. Remember, once you have had pelvic floor repair, you shouldn't lift more than 15 kilograms forever. Sexual intercourse. Initially, post-operatively, the surgeon can advise you about when you can resume intercourse. Usually people like to wait until the 6-week checkup to know that the stitches are healing. Be gentle when you first resume intercourse. It is important to use lubricant initially. There are many different brands of lubricant available at the supermarket or pharmacy. When trying a lubricant, always stop and change it if you notice any stinging or irritation. Olive oil can also be used if there are skin sensitivities with other lubricants. This information is provided as a guide for your recovery after surgery. If you have any specific concerns, please speak to your doctor.